MRI scans are an important tool to use when caring for someone with MS. In my previous video, I talked about the diagnosis of MS. In this video, I want to talk about monitoring MS and implementing treatment. Let's start by talking about monitoring MS. For someone who is diagnosed with MS, they need to undergo an MRI scan every single year. Often this scan is conducted with a contrast. That's just to highlight active patches of inflammation in the white matter, so active plaques if they're there. When doctors look at the yearly MRI scans of someone with MS, they look for changes in the MS. Is it stable or is there something new? Can they see new plaques? If they see that there is a change in the condition, then it means they're going to need to change the treatment. And when I say treatment, the medical treatment involves disease-modifying therapies, an array of medications that are now available for treating MS, and so different drugs could be tried. From a therapist point of view, when someone comes to my clinic and they report getting worse, they might not be able to walk as well, or they might not be able to use their hands as well. What I need to sort out is what are the new lesions and what are the old lesions. If I can only see old lesions in the scans, I know that these symptoms are because this person is getting deconditioned, and I know that I can be a little bit more aggressive with my treatment. On the other hand, if I can see new lesions and those new lesions could explain the symptoms that the person is complaining of, then I know I need to be a little bit more gentle because they've got active inflammation happening at the moment. Sometimes there is a combination of both. There is new patches, there's new plaques, and there's some old plaques. And then the skill of the clinician is in identifying the exact location of the new plaque and the exact location of the old plaque or plaques, and then correlating symptoms. Can the symptoms be explained by the new plaques or the old plaques? And then that guides the treatment, because if it's the old plaques, you'd go more aggressively, and if it's the new plaques, then you'll go a little bit more gently. I hope you now understand why MRI scans are so important for MS. If you want to learn more about how brain imaging can be used in rehab, head to my website and take one of the courses, or book me for consultation. I'll see you in the next video.